The topic of the tutorial is pharynx, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads. Introduction to pharynx, in which we will do the functions, location, and size of pharynx. Then we will study nasopharynx, oropharynx, and laryngopharynx in details, followed by wall of pharynx, then the constrictors and the longitudinal muscles of pharynx, nerve supply, sensory and motor, blood supply of pharynx, auditory tube, Waldeyer's lymphatic ring, and palatine tonsil. This is the lateral view of pharynx. Here we can see the posterior view of pharynx, and here the posterior wall of the pharynx has been cut open and we can see the inside of the pharynx. Here we can see that pharynx is communicating anteriorly with the nose, oral cavity and the larynx. This is the sagittal section of pharynx. Pharynx is a muscular tube which is situated behind the nasal cavity, mouth, and larynx. It is a passage for both the food and the air. It is a common site of infections. Pharynx is a 12 centimeter long muscular tube which is situated behind the nasal cavity, oral cavity, and larynx. Behind it is present the cervical vertebrae. It is present below the base of the skull, and inferiorly it is continuous with the esophagus at the level of sixth cervical vertebrae. The part of the pharynx which is present behind the nasal cavity is called nasopharynx. It is a passage for air. This part of pharynx which is present behind the oral cavity is called oropharynx, and it is a passage for both food and air. This is laryngopharynx, which is that part of pharynx which is present behind the larynx, and it is a passage for food. Nasopharynx. Nasopharynx is a part of pharynx which is present behind the nasal cavity. It is a passage for air. The extension of nasopharynx is from the base of the skull above till the soft palate below. It communicates anteriorly with the nasal cavity or the nose, and below it communicates or is continuous with oropharynx. Its relations are: anteriorly it is related to the nasal cavity, and posteriorly it is related to the body of sphenoid and the first cervical vertebra. Superiorly it is related to the base of the skull and the body of sphenoid, and inferiorly it is related to soft palate. Laterally it has the opening of auditory tube in its wall. The structures which are, or the features which are seen in nasopharynx are as follows: opening of the auditory tube, tubal elevation, which is an elevated area around the opening of the auditory tube that also has tubal tonsils present in it. Pharyngeal tonsils are present in the roof of the nasopharynx. Oropharynx is that part of the pharynx which is present behind the oral cavity. It is a passage for food and air. Its extension is from the soft palate above to the epiglottis below. Its communications include: anteriorly it communicates with the oral cavity, above it communicates with the nasopharynx, and below it communicates with the laryngopharynx. Its relations are: anteriorly it is related to oral cavity, posteriorly it is related to the second and the third cervical vertebrae. Superiorly it is related to nasopharynx and the soft palate, and inferiorly it is continuous with the laryngopharynx and is also related to epiglottis. Laterally in its wall is present tonsillar fossa that contains the palatine tonsil. The features of oropharynx include the presence of palatoglossal and palatopharyngeal folds. Between the palatoglossal and the palatopharyngeal folds is present palatine tonsil. Laryngopharynx is that part of pharynx which is present behind the larynx. It is a passage for food. It extends from epiglottis above till the lower border of cricoid cartilage below. Its communications are anteriorly it communicates with larynx, above it communicates with the oropharynx, and below it is continuous with esophagus. Its relations are anteriorly it is related to larynx, posteriorly it is related to the body of fourth and fifth cervical vertebrae, superiorly it is related or continuous with oropharynx, and inferiorly it is continuous with esophagus. Laterally it has a structure called pyriform fossa present in its wall. Features or structures seen in the wall of laryngopharynx include pyriform fossa and Killian's dehiscence. Wall of pharynx from inside to outside is composed of mucosa, submucosa, and outside submucosa is present pharyngobasilar fascia. Pharyngobasilar fascia is also known as pharyngeal aponeurosis. These three layers, that is mucosa, submucosa, and pharyngobasilar fascia, together forms a fibrous sheet which is present internal to the pharyngeal muscles. Muscular coat is composed of inner longitudinal muscles and outer circular muscles. The inner longitudinal muscles consist of stylopharyngeus, salpingopharyngeus, and palatopharyngeus, and the outer circular muscles consist of the three constrictors. Outside the muscular coat is present the buccopharyngeal fascia which forms the outermost covering of the constrictors. So the five layers from inside to outside are mucosa, submucosa, pharyngobasilar fascia, the muscular coat which consists of inner longitudinal and outer circular muscles, and the buccopharyngeal fascia. Pharyngeal plexus of veins and nerves is present between the constrictors and the buccopharyngeal fascia. Starting with the muscles of pharynx, first we will do constrictors of pharynx. There are three constrictors of pharynx. They are the superior constrictor, the middle constrictor, and the inferior constrictor. The superior constrictor muscle takes origin from the pterygoid hamulus, pterygomandibular raphe, medial part of the mandible, and the posterior part of the tongue. The origin of middle constrictor is from the stylohyoid ligament, its lower part, and from the lesser and the greater cornu of the hyoid bone. This is the lesser cornu and this is the greater cornu of the hyoid bone. Inferior constrictor muscle has two parts: thyropharyngeus, which takes origin from the thyroid cartilage, and cricopharyngeus, which takes origin from the cricoid cartilage. The thyropharyngeus muscle takes origin from the oblique line of the thyroid cartilage, from the inferior tubercle of the thyroid cartilage, which is an elevated area present here, tendinous band that crosses cricothyroid, this one, and the inferior cornu of the thyroid cartilage, which is this. The cricopharyngeus muscle takes origin from the posterior part of the cricoid cartilage. Insertion of the constrictors of pharynx. On the posterior wall of the pharynx is present a median raphe. This median raphe is attached above to the pharyngeal tubercle on the basilar part of the occipital bone, and all the constrictors of pharynx get inserted into this median raphe. The arrangement of constrictors. The constrictors are arranged in such a manner that the lower part of the superior constrictor is overlapped by the upper part of middle constrictor. The lower part of the middle constrictor is overlapped by the upper part of the inferior constrictor. This arrangement helps to strengthen the wall of pharynx. Nerve supply of the constrictors of pharynx. All the constrictors of pharynx are supplied by cranial accessory nerve, which is the 11th cranial nerve. The fibers of cranial accessory are distributed via vagus nerve, which is the 10th cranial nerve. These nerves participate in the formation of a network around the pharynx called the pharyngeal plexus. These pharyngeal plexus supplies the constrictors of pharynx. However, cricopharyngeus muscle receives an additional nerve supply from the external and the recurrent laryngeal nerves. Action of the constrictors of pharynx. Rhythmic contraction of the constrictors of pharynx, that is first of the superior constrictor, then the middle constrictor, and then the thyropharyngeus part of the inferior constrictor will push the bolus of food downwards from the oropharynx into the laryngopharynx. When the contraction of the constrictors of pharynx takes place, at the same time cricopharyngeus will relax. Cricopharyngeus is a muscle that acts like a sphincter that allows the bolus of food to pass from the most inferior part of the pharynx into the esophagus. There are three constrictors of pharynx, and they are the superior constrictor, middle constrictor, and inferior constrictor. There are present gaps between the constrictors, and certain structures pass through them. The structures passing through the gaps between the constrictors are as follows. Upper border of superior constrictor and base of the skull has a large semilunar gap called sinus of Morgagni. Structures passing through it are auditory tube, levator villi palatini muscle, ascending palatine artery, and the palatine branch of ascending pharyngeal artery. Through the gap between the superior constrictor and middle constrictor, the structures passing are stylopharyngeus muscle and the glossopharyngeal nerve. Through the gap between the middle constrictor and the inferior constrictor passes the internal laryngeal nerve and the superior laryngeal vessels. And through the gap between the lower border of inferior constrictor and esophagus passes the recurrent laryngeal nerve and inferior laryngeal vessels. Killian's dehiscence. Killian's dehiscence is an area of weakness present in the posterior wall of pharynx. It is present at the level of thyropharyngeus. This area of weakness is because of lack of overlapping between the muscles in this particular area. Pharyngeal diverticula is outpouching of Killian's dehiscence. First of all, we have understood that this is a weak area where there is lack of overlapping of the muscles. Moreover, thyropharyngeus and cricopharyngeus have different nerve supplies. Sometimes neuromuscular incoordination may occur. If that happens, then when thyropharyngeus contracts, cricopharyngeus may fail to relax. And we know that cricopharyngeus is a sphincter, and if it does not relax, the bolus of food will not be able to pass from the pharynx into the esophagus. The bolus of food will remain in the pharynx, and due to contraction of thyropharyngeus, the bolus of food is pushed in the posterior wall of pharynx, producing outpouching of this area because this is a relatively weaker area as compared to the rest of the wall of the pharynx. Longitudinal muscles of pharynx. There are three longitudinal muscles of pharynx, and they are stylopharyngeus, palatopharyngeus, and salpingopharyngeus that run longitudinally along the length of pharynx. Stylopharyngeus takes origin from the styloid process. Initially, it is present on the outer surface of the superior constrictor. Then it passes through the gap between the superior constrictor and the middle constrictor. Further, it descends on the inner surface of the constrictors of pharynx. So initially it is present outside the constrictors, and then it runs on the inner surface of constrictors. Palatopharyngeus takes origin from the soft palate and descends on the inner surface of the constrictors of pharynx. Salpingopharyngeus takes origin from the auditory tube. It descends, then merges with the palatopharyngeus and further descends along with it. Action or function of the muscles of pharynx. The muscles of pharynx helps in the second stage of deglutition. The longitudinal muscles, when they contract, they help to shorten the length of pharynx. The constrictor muscles, when they contract, they help to constrict or narrow the passage of pharynx. It is rhythmic contractions of superior constrictor, middle constrictor, and thyropharyngeus component of inferior constrictor that helps to push the bolus of food down. This means that when superior constrictor muscle will contract, the bolus of food will be pushed down. After that, the middle constrictor will contract and will push the bolus of food further down. When the bolus of food reaches the inferior part of pharynx, where thyropharyngeus and cricopharyngeus is present, then thyropharyngeus contracts and cricopharyngeus relaxes at the same time to push the bolus of food further down from the pharynx into the esophagus. This is so because cricopharyngeus is a sphincteric muscle and it must relax to push the bolus of food from the pharynx into the esophagus. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Nerve supply of pharynx. Sensory nerve supply of pharynx is by pharyngeal plexus. Pharyngeal plexus is a network of nerves present around the pharynx which supplies pharynx. Pharyngeal plexus receives contribution from three nerves. They are 1. Pharyngeal branch of vagus, which is the 10th cranial nerve that is actually carrying the fibers of cranial accessory, which is the 11th cranial nerve. Second, pharyngeal branch of glossopharyngeal. Third, pharyngeal branch of superior cervical sympathetic ganglion. All these three pharyngeal branches from three different sources contribute to the formation of a network around the pharynx, and the sensory innervation is received from this pharyngeal plexus. Motor innervation of pharynx is by cranial accessory nerve, which is the 11th cranial nerve, whose fibers are distributed through vagus, which is the 10th cranial nerve. All the muscles of pharynx are supplied by cranial accessory nerve except for stylopharyngeus, which is supplied by glossopharyngeal nerve. Glossopharyngeal nerve is the ninth cranial nerve which supplies stylopharyngeus muscle. Cricopharyngeus muscle, which is the inferior-most part of the constrictors of pharynx, also acts like a sphincter present at the junction of pharynx and esophagus. Cricopharyngeus muscle receives an additional nerve supply from external and recurrent laryngeal nerves. Blood supply of pharynx. Blood supply of pharynx is primarily by ascending pharyngeal artery. Ascending pharyngeal artery is a branch of external carotid artery. After given off from external carotid artery, pharyngeal artery ascends on the surface of pharynx and supplies blood to pharynx. Apart from ascending pharyngeal artery, blood supply of pharynx is also contributed by branches of facial artery, lingual artery, and maxillary artery. Branches of facial artery that supply some areas of pharynx are ascending palatine and tonsillar. Lingual artery supplies blood to pharynx through dorsal lingual branch. Maxillary artery also supplies blood to some areas of pharynx via its three branches, that is, greater palatine, pharyngeal, and pterygoid branches. All the arteries supplying blood to pharynx are branches of external carotid artery. Auditory tube. Auditory tube is also known as Eustachian tube or Pharyngotympanic tube. It is a 4 cm long, trumpet-shaped tube. It helps in connecting nasopharynx on one side with the middle ear cavity on the other side. This is the external ear, this is the middle ear, and this is the internal ear. Here, this is the external ear, this is the middle ear cavity, and this is the internal ear. Eustachian tube connects middle ear cavity on one side with the nasopharynx. In the nasopharynx, in its lateral wall, is present the opening of the Eustachian tube. Here, we can see the opening of the auditory tube or the Eustachian tube. Auditory tube has two parts. This is the auditory tube and its two parts are the bony part and the cartilaginous part. The bony part forms 1/3 of the tube. It is the posterolateral part of the tube that is about 12 mm long. It is present in the petrous part of the temporal bone and its posterior end or posterolateral end opens in the middle ear cavity. Its anteromedial end gives attachment to the cartilaginous part. 2/3 of the auditory tube is formed by the cartilaginous part. The anteromedial part of the auditory tube is the cartilaginous part, which is about 25 mm long. This is the cartilaginous part of the auditory tube, which lies in sulcus tubae. Sulcus tubae is a linear depression which is present between the petrous part of the temporal bone and the greater wing of sphenoid. The posterolateral end of the cartilaginous part of the auditory tube is attached to the bony part, and the anteromedial end opens in the nasopharynx and forms an elevation in the lateral wall of the nasopharynx called tubal elevation. This is the opening of the auditory tube in the lateral wall of nasopharynx. Blood supply of auditory tube. The blood supply of auditory tube is received from 1. Ascending pharyngeal artery. Ascending pharyngeal artery is a branch of external carotid artery. 2. It is received from middle meningeal artery, and middle meningeal artery is a branch of maxillary artery. The nerve supply of auditory tube from medial to lateral is by the pharyngeal branch of maxillary nerve, nervus spinosus branch of mandibular nerve, and tympanic plexus of glossopharyngeal nerve. The function of the auditory tube is that it helps in maintaining atmospheric air pressure inside the middle ear cavity. Middle ear cavity is a closed cavity and its only communication to the exterior is through the auditory tube. And via this communication, the pressure inside the middle ear cavity is also same as the atmospheric air pressure which is there in the nasopharynx. As a result, the air pressure on both sides of tympanic membrane is same, that is in the external ear and in the middle ear, and this allows the tympanic membrane to vibrate freely when the sound waves strike it. Clinical anatomy of auditory tube. This communication between the nasopharynx with the middle ear via the auditory tube also serves as a route of transferring infections from the nasopharynx to the middle ear cavity. Nasopharynx is present behind the nasal cavity and is a common site of infections, and these infections can easily travel through the auditory tube in the middle ear cavity. This is more common in children. It is so because the auditory tube in small children is shorter, straighter, and wider. Waldeyer's lymphatic ring. Waldeyer's lymphatic ring is a ring of tonsils which is present at the junction of oral cavity and nasal cavity with pharynx. This is the ring of tonsils. This is the ring of tonsils which is present at the junction of nasal cavity and oral cavity with pharynx. These are the posterior nasal apertures. This is the posterior part of the oral cavity. And this is pharynx. At the junction of nasal cavity and oral cavity with pharynx, we can see 4 pair of tonsils. When we draw a circle through it, it becomes Waldeyer's lymphatic ring. There are 4 pairs of tonsils in Waldeyer's lymphatic ring, and they are pharyngeal tonsils. Pharyngeal tonsils is present in the roof of the nasopharynx. Tubal tonsils, which is present in the lateral wall of nasopharynx. Palatine tonsil, which is present in the lateral wall of oropharynx. And lingual tonsils, which is present in posterior 1/3 of the tongue. They are present in pairs, and when we join them, they form Waldeyer's lymphatic ring. Waldeyer's lymphatic ring comprises of 4 pair of tonsils. Tonsils is mucosa-associated lymphoid tissue, in short called MALT. Mucosa-associated lymphoid tissue is aggregation of lymphoid tissue in the mucosa. This is the epithelial lining of pharynx, which is stratified squamous non-keratinized epithelium with associated lymphoid nodules. This ring of tonsils acts like a first line of defense against the disease-causing microorganisms that are inhaled in the air or ingested in food. Clinical anatomy of Waldeyer's lymphatic ring. Adenoids. Adenoids is hypertrophy or enlargement of the pharyngeal tonsils. It occurs most commonly in children. The enlargement may be so large that it may block the posterior nasal aperture, thus obstructing the breathing. This may lead to mouth breathing. It may even cause speech defects. However, it usually regresses by puberty. Tonsillitis is inflammation of palatine tonsils. Sometimes the infection and inflammation may be so severe that it may result in peritonsillar abscess, which is known as quinsy. It occurs most commonly in children and usually regress by puberty. Hypertrophy of tubal tonsil may cause middle ear problems. Tonsillectomy. Tonsillectomy is surgical removal of tonsils. This is done more commonly in children. This is performed only when enlarged tonsils do not regress with medication. They become a constant site of infection and pain and start interfering with normal activities of a child like breathing, speech, and other normal activities. Palatine tonsils. Let us try to understand the location of palatine tonsils. This is the palatoglossal arch and this is the palatopharyngeal arch. When we open our mouth wide and keep saying ah, we can clearly see both palatoglossal and the palatopharyngeal arches. In the sagittal view, this is the palatoglossal arch and this is the palatopharyngeal arch. Between the palatoglossal and the palatopharyngeal arches is present a depressed area called tonsilla fossa. In the tonsilla fossa is present palatine tonsil. Palatine tonsil is shaped like an almond. This is its anterior border and this is its posterior border. It has two poles, the upper and the lower pole, and it has two surfaces, the medial and the lateral. The anterior border of palatine tonsil is related to palatoglossal arch, and the posterior border is related to palatopharyngeal arch. Its upper pole is related to soft palate. Its lower pole is related to tongue. The two surfaces of palatine tonsil are medial and lateral surfaces. Medial surface is this surface which faces the oral cavity. It is covered with stratified squamous non-keratinized epithelium and has 12 to 15 depressions or crypts present in it. These crypts help to increase the surface area. The largest crypt is called intratonsillar cleft, and peritonsillar abscess or quinsy begins in the intratonsillar cleft. The lateral surface is the surface which faces the tonsillar bed and is related to the tonsillar bed and is covered with fascia. The tonsillar bed is formed by pharyngobasilar fascia, superior constrictor muscle and the palatopharyngeus muscle, buccopharyngeal fascia, styloglossus muscle and glossopharyngeal nerves. Arterial blood supply of palatine tonsil. The main source of blood to palatine tonsil is from tonsillar branch of facial artery. Apart from that, blood is also received from ascending palatine branch of facial artery, greater palatine branch of maxillary artery, dorsal lingual branch of lingual artery, and ascending pharyngeal branch of external carotid artery. Venous drainage from palatine tonsil is into palatine, pharyngeal, and facial veins. Lymphatic drainage is into jugulo-digastric group of lymph nodes. Nerve supply to palatine tonsil is by glossopharyngeal nerve and lesser palatine nerve. Clinical anatomy of palatine tonsil. Tonsillitis is inflammation and infection of palatine tonsils. Accumulation of abscess in the peritonsillar region is called quinsy. Tonsillitis occurs most commonly in children and usually regresses by puberty. Tonsillectomy is surgical removal of tonsils. It is done more commonly in children. Initially, medications are given. Even after medication, if the enlarged tonsils do not regress and become a constant site of infection and pain, and start interfering with breathing, speech, and other normal activities of a child, then only in this condition that tonsillectomy is done. Questions from pharynx that may be asked in the examinations are short notes on nasopharynx, oropharynx, laryngopharynx, muscles of pharynx, constrictors of pharynx, arrangement of the constrictors of pharynx, pharyngeal diverticular or Killian's dehiscence, palatine tonsil, Eustachian tube, also called auditory tube or pharyngotympanic tube, Waldeyer's lymphatic ring, tonsillitis, and why are middle ear infections common in small children?